Hi, and welcome to our debate. Today we are going to be talking about should a free and appropriate public education, FAPE, be included in ABA services for children and youth with ASD in the school. My name is Kayla Shalaba. We have Teresa, Rachel, and Olivia. I will start off the debate by being con ABA services. Schools often do not have the faculty to provide ABA services. In non-public agencies where these services are provided, it's usually a one-to-one ratio. In the school setting, typically in special education classrooms, the ratio is not this short. In some cases, there'll be a 3-to-1 staff, but the 1-to-1 where you really get the intense ABA services cannot be provided. In addition, schools typically do not have the training that is properly done for these staff to provide ABA services. As of 2018, most insurance companies who fund ABA services require that individuals directing ABA be RBTs. In addition, with insurance companies being providers of ABA now, there's not really a reason for the school districts to be providing it through FAPE. It is unclear if school districts are going to begin requiring that their staff are RBT registered as well under the supervision of a BCBA. In addition, it's unethical for a BCBA to allow special education teachers or paras to provide ABA services if they're not in compliance with Code 102 boundaries of competency. If they don't have the training that is appropriate for this and they do it anyways, they are in violation of this code. Harvard Research recently did a survey, and they estimated that the added cost of ABA services with autism, that a child with autism's education averages around $17,000 per child per year in the USA. The per child cost right now for a quality education in a school district ranges from $5,000 up to $20,000 with the mean average of $7,000. Therefore, these school districts are forking out $10,000 more in order to provide these children with the appropriate ABA services. And these are services that can come through an insurance company and don't need to come from the pocket of the school district. In addition, ABA services do not just focus on education, which is something that's focused entirely in the school district. They focus on communication, play and social skills, behavior modification, and daily and self-help skills. These skills are not a priority that should be taught in the school. These skills should be taught in the home or the community setting. Changes in the idea require that IEPs facilitate progress in the general curriculum for all students. This year alone, only 50% of students passed the English STAR exam, and only 38% of students met or exceeded it. This is less than 50% of typically developing kids. Kids with autism already need to play catch up. We can't afford to have them taking the time in the school setting to be learning play and social skills and communication when they're already so academically far behind. An appropriate environment. So under the idea, it is a requirement that these school districts place students in a least to most intrusive environment. First off, being the general education classroom where students need to start. From there, if that's not an appropriate placement, they will move on to the special classes. If that is not an appropriate placement, then they will move to the special schools, home institution, or hospitalization. If we're sending these kids to special classes for them to get ABA services, we've already broken a rule under IDEA by not placing them in the least to most intrusive environment. They should be in the general education classroom first, where they are around students of typically developing peers, and they shouldn't be in a classroom with just children with disabilities. It is a requirement that they are in these classrooms, and the special ed classrooms do not meet this requirement, as they do not have students who are typically developing. I will now pass the debate on to Rachel, who will be talking pro ABA.
Okay, so in the special education room, there are many services provided for children with disabilities. This includes speech therapy, occupational therapy, management programs. Students with ASD in the special education programs get more services than other students. And students with ASD in the special education room have higher opportunities of getting physical education, specialized computer software that can help them with their ASD and elder development, and special transportation coming to and from school to help parents and assist in easier transportation and that delivery for the kid adjusting from home to school every single day. And secondary students with ASD, so this means the higher education, which is high school, students have a greater opportunity of getting mental health or social work services to help provide them to the greater opportunity of life or quality of life. I'm sorry. Parents whose children with ASD in special education have 86% satisfaction with their child getting these services in the special education room, while other disabilities in the special education room have a 91% satisfaction, but are happy with the one-on-one time that is provided with their children. So this means that parents with kids with ASD are a little less dissatisfied than the parents with other disabilities, but they're happy that they still get that one-on-one time because one-on-one time can be provided in the special education room. It might not be the full time that the student is in there, but it is part of the time that is some of the programs that they work on. And then when a child gets diagnosed with ASD, it takes an average of 76.9 days for parents and children to get ASD services. So having that big wide gap for children to get diagnosed and then the start of services, there's a lot of early intervention work that could be done. So benefit is having these children in the special education room so they can get that one-on-one time and get more familiar with this area. And then next I'll be talking about the training for special education teachers. So as talked before, most special education teachers do not have the criteria to do ABA, and that is a huge problem. There is a program that is geared towards special education teachers to enhance their understanding for all matters of autism and education. The program is made up of 5 courses that are online and face-to-face to earn a certificate into ASD. Special education teacher rates are dropping because few to qualified professionals are open to fill the positions. And they feel that when they are hired in, they do not have the ability to treat these children with autism. So it's a harder job for them to do because they don't have the understanding. State funding has prevented public schools from hiring new teachers to meet the needs of children with ASD. This is a huge problem because with the growing rate of ASD being higher than any other time in our history, that we need to have this state funding to get these services in the public schools. Hiring well-trained special education teachers can provide interventions for children with ASD and other disabilities. So this doesn't mean that we need additional special education teachers, we just need them to be more qualified and trained. ASD specific research based interventions were analyzed by the National Standards Project, reviewed 775 studies to find effective treatments for ASD. 11 treatments were found beneficial, 22 emerging treatments had some effectiveness. So that means that these special education teachers can use these interventions once they get their training and their certificate in ASD and provide them into the special education classroom. And then on my next slide, I'll talk about why these teachers need to get this special education training. So under FAPE, it states that all children with disabilities have an opportunity for free and appropriate education, which is programmed to the student's needs. So that means that while under this law, it says that students need and have to have the opportunity to get the right kind of services, that most children with autism aren't getting the right kind of services that they need due to lack of money, due to lack of to the training from the special education teachers. But this means that we need to train these teachers to get this opportunity for them to have these interventions in place. Appropriate education can be defined as meeting the needs placed in the correct classroom with the appropriate related services such as speech therapy, occupational therapy, physical therapy, psychological counseling, medical diagnosis services, and educational purposes. So this means that SLP, OT, and physical therapy may be beneficial for the child to get removed from the educational standard classroom and brought down to special education. So from that time, these services are very beneficial for the child with autism, but having the behavioral management skills need to be in place, and with the teacher training, this can be effective for these children. And under FAPE, with an idea, it states that children with disabilities, including autism, need special education related to the services. So this clearly states that children with ASD need special education. So this means that they do need to be down in the special education room, but better plans and more intervention needs to be in there. And while it also states that children with disabilities have and need the opportunity to be with other development or typical developing children, what can happen is during some of the time in general education room, they can be there during recess or during reading time, where it is more beneficial for the child to see how other kids are interacting and for them to get that socialization. But they can also be brought down and be removed from certain times in the classroom to the special education room to get that one-on-one time, to get all these therapies like OT, PT, SLP, and also behavioral management interventions. So yes, there are some problems. We do need more funding, but once we do have this funding, we need to start educating teachers and getting interventions put into the classroom for these children, because under FAPE, it states that children with autism need special education. And next, we're going to move on to the cons of special education.
Hi, I will be focusing on the cons of special education from a general education teacher's perspective. When looking at the litigation and the cases that involve FAPE, Katsiani, Counts, Popham, Ryan, and Butzer define that FAPE is provided when a student's IEP is developed according to the procedures and services outlined in the IEP that are carefully designed to confer with the educational benefit. Maximizing potential is not required. Now, when we're looking at the services that the service exactly as a definition of appropriate is to ensure that the child is receiving a curriculum designed to ensure he or she is receiving the maximum benefit and services I'm able to provide as a general education teacher. Limited training I have in working with children on the autism spectrum. When, as we go through, I also have to ask, does our school have the supports in place for the child and myself to ensure that I am able to demonstrate that he or she is making meaningful progress? Also, finding meaningful progress. I myself do not want to find myself in any situations similar to other school district litigation, such as the county did in 15 for services. Even the student that has autism, I also need to look at the health school district. In 2015, the New York State Education Department cited, and it did involve a child with autism, ADHD, and PD. The school had decided that it would be in the child's best interest to remove the child from a special resource room where they were receiving one-on-one instruction and put them in class where behaviors obviously came up that we would see typically of students on the spectrum, and the general education teacher was just not prepared and trained to be able to resolve the behavior issues or to provide the services that this child needed. Therefore, the school is held liable and did have to reimburse the parents for private school tuition. As a school system, as a school district, with budget cuts and everything that is going across the lines, I feel that my training as a general education teacher and my experience with ABA is limited, and it would put us in a different liability issue. Now, when looking at my next slide and looking at the theoretical and practical issues, again, I look at the teachers and the training that were provided and the self-efficacy that as a general education teacher I have. In college, teachers are required to take classes for academic instruction, but the experience is limited as to what working with children that have exceptional needs. Costco and Wilkins in their study found that research suggested teachers are not given enough opportunities for professional development on inclusion-based practices. The research itself, when we try to and look into why teachers and how many hours a teacher should receive in order to feel confident and have the ability to work with children on the spectrum or other children with exceptional needs, there is no specific answer. Of course, we can all agree that having some training is better than no training, but what exactly is the amount of training that it will take in order for a teacher to feel that they are confident and able to work with a child that is on the spectrum and utilize effectively some of the ABA techniques and strategies? If the training is very limited, excuse me, study continued to indicate that the large amounts of training that it would take to have a meaningful impact would be 8 or more hours, all throughout the school day and throughout the school year, with as many meetings and additional professional development that we have. What is the implication of taking myself out of the classroom for additional training for a student, as well as the impact that that would have on other students in the classroom? Although this would allow me to better adapt my instruction in an inclusive setting, the amount of hours that it would take would not be equivalent to what is needed to help the child. Now, in addressing teacher preparation, and again, looking at the self-efficacy and the attitude that general education teachers have, it is beneficial to provide teachers with the opportunity to gain more strategies. And this is something that we can look at even at a collegiate level in adapting more classes for general education teachers outside of the academic preparation and instructional preparation. Now, when we're looking at the strategies of gaining instruction and behavior management for their students with special needs, all the stakeholders involved, especially the students, would benefit from additional training. In general, have an attitude that concerning inclusion than those with more extensive professional development. So this supports why we would want to have that increase, although currently there are teachers that do not feel prepared as they can. When we're looking at a college level, the coursework is often seen as ineffective. Few hours spent in professional development geared for general education teachers and the inclusion practice. The study that Wilkins did indicated that the more preparation the teachers had and more preparation and training throughout the year, the more confident the teachers felt. Again, my question would be, as a school district, where are these additional hours going to come in? When are they going to come in? And is 8 hours the magic number that is going to make a general education teacher feel that they are confident and able to work with the child, with especially a child on the autism spectrum? ABA training is seen as an essential strategy when working with children on this. But again, how feasible is it to consistently and continuously send teachers out of someone come into the building and disrupt the environment in which the other children are learning as well? There is a disproportionate attitude as well, which I can see impacts how general education teachers come together in working. Training inclusion and teachers in these, whereas the study compared special education teachers at 88% So when we're looking at that and that teacher preparation attitude, teachers who have a special education background and have a special education training definitely feel that a general education teacher should be when you look at the comparisons and teachers complete surveys or do self-evaluations from a general education teacher's perspective, the ability and being equipped to work with a child on the spectrum or getting training in ABA is just not something that is feasible. Therefore, that is why children that are on the spectrum and ABA training should come from a specialist and not a general education teacher. And Teresa will be continuing on with the next slide.
So I am for special education and ABA being within our special education programs. Coming at it from a parent perspective, looking at the National Standards Project, ABA is proven to be one of the most evidence-based treatments for ASD. It is one of the most effective, and there's studies that go beyond to kind of show that it helps show improvements in the developmental skills, their behaviors, and daily living. It also found that children who receive early intervention, including strategies and components of ABA, show improvements in several developmental domains, and that's including their maladaptive behaviors. So we're not just looking at education as that piece, but we're also looking at their behaviors within a classroom setting, because if we are looking at trying to place these children in inclusion classrooms, we need to also think about their behaviors and not just their development and their educational goals. In this study specifically, they used a group of 59 students, and after 1 year of treatment of half of the children receiving early intervention and the other half receiving their usual treatment in the classroom, the children in the early intervention group showed significant improvements in their adaptive behaviors and their maladaptive behaviors and their autism symptoms after 1 year of treatment. So it showed that there's benefit to ABA being in the classroom, that these kids were able to show progress in a year's time as opposed to your typical developing special education classroom. In another study by Eldevig and Hastings, John Hughes, they found that even when provided with less hours that included the intensive intervention, these programs did better than special education programs, and that over time, these kids were showing higher IQ scores. So 31 children with autism ranging from the ages of 2 to 6 who received behavioral intervention in a preschool setting were compared against 12 children who were receiving the treatment as usual in special ed. After 2 years of them receiving the behavioral intervention as applied by a BCBA, they were receiving higher IQ scores. So it obviously was showing that even in this short amount of time, and when provided less hours than the treatment as usual special education programs, these kids were receiving higher IQs and were showing higher cognitive skills. And I want to note that BCBAs are receiving the necessary skills and knowledge to teach children with autism. So not only are they equipped with a master's degree, but they're also receiving time within the field, and they're also made to complete supervised field work and being supervised by someone who's already been in the field. So they're obviously learning all the necessary skills to work with these kiddos. And I feel like in our special education programs, our children are not receiving that. So if we go to the next slide, we can talk about the cost of ABA within special education. So generally, per child each year, it averages around $12,000 for a special education program and around $6,000, and that's within the state averages. So there's obviously more money that goes into these children, but they need specialized teachers, they need supports within the classrooms, including visuals, timers, sensory corners, and they're also receiving the extended therapy, so occupational therapy, physical therapy, and speech. Our goal should be to teach the child so that they become developmentally capable of being mainstreamed into general education. The goal of the BCBA should be to provide evidence-based procedures and to promote autonomy and independence for future living. This isn't always the case in a special education program. As usual, We see the teachers kind of doing busy work for the kids, and they're not necessarily equipped with the right strategies and the right training. In the study completed by Chanson, Harrison, and Neely in 2007, they compared 18 years of special education versus 3 years of discrete trial training. Now, discrete trial training is a form of and a strategy of ABA, and it proved to show more improvements over a shorter period of time. So the kids who were receiving 3 years of discrete trial training showed more progress. These kids were ready for inclusion, and they were increasing all areas in their developmental domains. So as a district, if you think about it, we can save money. So as opposed to doing 18 years of special education, these kids did 3 years of discrete trial training with a BCBA, and were able to show more progress as opposed to 18 years of special education. So that just goes to show that, yes, there is money in it, but we're able to save money and save time by providing the right and the necessary teachings for these kids. And the next study that I examined, Cohen, Dickens, and Smith, they compared 21 children who received 35 to 40 hours of ABA per week to the control group of 21 age and matched by IQ kids in a public school special education. So those kids who were receiving the 3 years of ABA as opposed to the 3 years of special education were displaying higher IQs, they were displaying higher levels and increased progress. So again, it's showing that these ABAs are able to provide a better education for these kids. The other option that I've considered is that, like Kayla was saying earlier, a lot of insurance companies are requiring that if a child is receiving ABA, that we use an RBT to implement these procedures. So an RBT is a certification that a lot of special education teachers can acquire. And if a program is at least supervised by a BCBA, we can look at getting our teachers trained in terms of RBT. So the cost of training for an RBT can range anywhere between $85 to $200. It's a 40-hour program where you put in 40 hours of training and learning, and you become a registered behavioral technician. And then after, it costs $45 to take the exam through the BCBA board. It is a certification that teaches you about autism and all of the basic strategies and tenets that you should be using within BCBA and the ABA programs. But the problem is that a lot of our special education teachers either do not have the access or the money or the time to do any of these things. And I think this is something that should be a requirement of the schools and not just the insurance companies. On my next slide, I talk about some of the laws and litigation. So within the U.S., the CDC estimates that it costs an extra $17,000 a year to take care of each child with autism. And this is including doctor's visits, extended therapies, equipment, education, care. A lot of families are paying out of pocket. So because of this, the U.S. decided to require that states cover autism under the insurance. So yes, while these kids are receiving ABA at home, we also have to consider that at home, they're working on at-home skills, daily living, adaptive, and self-help skills. But under the school education, are they receiving the right type of strategies and treatment? And I don't think that's necessarily the case. The state, or the government also passed IDEA, which was basically another branch of litigation that basically stated that we needed to provide all children with free and appropriate public education. Now, this isn't always necessarily the case because we have kids who are not receiving the right programs, or we have programs that aren't fit to control or work with these kids or to teach these kids the appropriate skills to get them into an inclusion program. Under IDEA, they also created the No Child Left Behind Act of 2001. And the premise behind that was that children with disabilities would be allotted necessary accommodations and adaptations, that we didn't want to leave any kids behind. We wanted them to learn and grow at the same rate of your typical developing child. Now, again, this is very difficult with a kid with autism, especially a kid who's more severe, who's nonverbal. So we need to make sure that in these classrooms, these kids are receiving the necessary accommodations and adaptations. But if the teacher is not equipped and not educated enough to provide the right teaching strategies, are we really providing what that child needs to not be left behind? So the Act provides support for supplemental services for students persistently failing Title I funds, So approximately $500 to $1,000 per child for low achieving or disadvantaged students in the school to obtain supplemental services. Services have to be consistent with the goals in the IEP. So the problem is that although we're allotting all this extra money to the children, we may need to consider what type of money we need to allot to the teacher, because that teacher needs the right type of education to provide the right type of support to these children. Special education varies and is different for each kid, and what we're providing is different for each kid, but I think we can all agree that ABA is kind of a gold standard of what we should be providing for our children. And there's an estimate that around 6.1 million students with disabilities in the U.S., and that this new law should ensure that they receive a quality education, but this isn't really happening. These kids are really falling through the cracks, and our special education teachers are not prepared, they're not ready, and they're not capable of teaching children with ASD. So on my next slide, I talk about ABA in the classroom and training our teachers, because I think if we are able to do this, then we are able to provide a better education for our children with ASD. We are able to provide a better environment. We're able to hopefully get them into a general setting. So for the first study I examined, the Locano and Barton in 2008, they reported that when looking at special education teachers, their background, their training, their degrees, that most of these teachers do not graduate with adequate training. So they receive training in special education as a generalized program, but they're not taught the tenets of ABA, they're not taught behavioral strategies, and they're not taught about working with children in an inclusion setting. And this is important because the goal with the No Child Left Behind Act and the goal with a lot of our programs is to provide a free and appropriate public education, to provide the least restrictive environment, but we can't expect to place these kids in a general ed classroom without the necessary support. So if we place a kid in a general ed classroom with a general ed teacher who does not have any training on ABA, then we have set that child up for failure. And you've set my child up for failure, because in the end, he's not going to learn, he's not going to make progress, and he's going to get lost in a classroom that he doesn't understand. Also, teachers within special education should be required to attend conferences or trainings to keep up with new research and advances in special education. So they recommended that if we do decide to train these teachers and we do give these teachers more education in terms of ASD, that we should also require that teachers have continuing education credits where they are attending conferences and keeping up on research, because as we know, there's constant new findings, new strategies that can be applied, things that we as specialists can try and use within our sessions. And I think a lot of times teachers have been working in the field for so long that they don't continue their learning. For the next study I looked at, it was called Evaluating the Effectiveness of Teacher Training and Applied Behavior Analysis, and talked about the effects of training teachers using a 90-hour ABA training. So 90 hours is excessive, it is a lot, but at the end of this 90-hour training and these teachers being placed back into their classrooms and working with their kids, the surveys that were done by the parents and done by the teachers showed a beneficial effect. So even the teachers were reporting that they felt they were more equipped. The parents were reporting that they were noticing a difference in the way that their children were learning and coming home and making progress. So I think overall the goal should be that ABA needs to be in the classroom, but we also need to be sure that we are requiring our teachers to be trained in the right way. So now we're going to move on to some of our questions. So one of our questions within the slides, that if we are discussing the idea of a BCBA being sufficient or being in the classroom, are we looking at having a BCBA be in the classroom at all times? Are we looking at several BCBAs? Or are we just looking at an RBT? Like, what would be the best option for us as a program, or for us as a state or as a government?
I think for the special education room, if those teachers get those trainings, we don't have to have a BCBA in the room. So like you said, Teresa, if we do have use some of that money instead of for the students, we can use some of it for the teachers, then those teachers can get those trainings, and then we won't have to pay a BCBA on the full salary, because they will have a certificate and they will get all the trainings that they need to do to be certified to teach in ASD. So instead of using that money for the children, we can save money by using it on the teachers, because once they get that certification, they're done. You don't need to pay anything more than that, except for maybe going to those conferences, which is way smaller than paying a full salary BCBA. And then all those special education teachers will be trained and will be able to treat children with ASD and do early intervention and other work with them, like behavioral management training, DTT, having those services inside the classroom.
Does anyone else want to touch on that?
I was just going to say, from a general education teacher's perspective, when we're looking at having that training come in, we still also have to take into account what is my responsibility, because as we're creating this child's IEP, I also have to have input, and we're looking at inclusion practices. So I also have to know what to do if the child starts to persever, if the child starts to have a meltdown. What is my responsibility in ensuring that the IEP is being put into full effect, really, and then also making sure that the additional training that I'm going to need, which is going to take me away from everyone else. Yes, you know, as a general ed teacher, I want to have all of the students in my classroom, but just like my students who do not have exceptional needs, I want to be able to treat my students with exceptional needs at that same element, without it inhibiting anybody else.
I also think underneath like the code of ethics, it is important for us to, even if we get the training that we have, it is important to us to constantly be under the supervision of a BCBA, especially if your paras and your teacher are going to be registered behavior technicians underneath the board. They have to be under direct supervision of a BCBA. So even as you guys continue to get the training and you continue to implement those things, I think just for legal issues, there has to constantly be a collaboration between the special education teacher, the general education teacher, as well as a BCBA on a constant day-to-day basis.
So for training, for supervision for a BCBA with any RBT or any technician, it only has to be 10% of the time supervised. So if you're working with 10 hours with a kiddo, only 1 hour has to be supervised. So to save money for the school district and allow students to get more hands-on interventions without a BCBA, if the school district had maybe like one BCBA for a certain amount of schools, or maybe two, depending on how big the district is, then the BCBA could come in to maybe the school like once or twice a week and just bounce around from schools to only have to do that 10% of the supervision time under the BCBA like guidelines and laws for supervision. So not necessarily will we have to have a BCBA in the room at all times, but we can have somebody certified, but also getting that supervision of the BCBA, just not in every school, to cut costs, and also for special education teachers to still have those intervention times with the kiddos.
Yes. However, the 0.5 hours, so if you're with a kid for 10 hours and you need 1 hour of supervision, that supervision has to be individual. So a BCBA can't come in and give all of that supervision in a group. So if you have 10 paras in the room and each of them need an hour a week, then you need that BCBA to be there for 10 hours during that work week.
One of the other questions that was asked was if 46 states are requiring coverage for autism under insurance and the insurance is covering ABA, then why should it be under the school district to provide ABA? And I think from my perspective, it's that we are seeing that ABA has a big impact on how these kids are learning and how they are progressing. And if we are using ABA throughout the entire day for this child, not just at home with the parents and with the family, but also within their education programs, that we are going to see them be able to excel more and be able to kind of exit some of these special education programs into some of the general ed programs, which in turn will cost the district less money. Does anybody else have comments on that?
I agree with you, Teresa, because under the laws that under IDEA and the FAPE, it states that children with autism are under the Disability Act, and that they need the right services. So what the state is saying and the government is saying, like, you need to have these services, but the problem is that there's really no opportunity for them to get the right services, even though it states that we need to give them the right services. So what we need is to have those teacher trainings or have a BCBA in the room. And like you said, once they gain those skills, they can generalize more and take those over into other classrooms, independent living, to get them the best quality of life possible. And the state is protecting that, but the way that it is getting processed is not 100% correct. So I agree with you.
Okay, anybody else want to touch on that, or are we good? No? Okay, and that will wrap up our presentation. Thank you guys for watching.